Alright, we're going to draw out some anterior Chapman points. So first we've got a manubrium, and we're going to make a big sternum off that manubrium. Off that sternum, we're going to have a clavicle, second rib, third, fourth, fifth, sixth, seventh. Once we get to 8, we're going to make that lump of 8 through 10. So again, we've got the clavicle, second, third, fourth, fifth, sixth, seventh. Off this clavicle up here, we're going to have a little first rib divot. So there's all of our skeleton. Next, we're going to be drawing out wherever all of our points are. So off the first rib, we're going to be having a point right here. Next, along the inferior aspect of the clavicle, we've got 3 points. On the top of the second rib and that first intercostal space, we have another 3 points. Once you get to the second intercostal space, we're along the sternum for 3 more down a row. Second, third, and fourth intercostal spaces. Fifth intercostal space, we move out laterally. And then we've got 5, 6, and 7. This is the general layout of the points. You're going to want to be able to draw these out, no problem. So this first rib point is the middle ear. Along the inferior aspect of the clavicle in the first intercostal space, we're going to be having the nasal sinuses over the sinuses. We've got the pharynx over the larynx. Then we have the tonsils over the tongue. And all these points correspond with these points over here on the left. So in our so that's our first intercostal space. We have those ones. Second intercostal space, we've got the myocardium, the thyroid, the esophagus, and the bronchus. I think of this as myo, thyro, eso, and bro. A bunch of things that end in the letter O. Third intercostal space, upper limb and upper lung. Fourth, we gotta have a lower lung. Once we get down to the fifth, it gets a little bit trickier. We've got right, and then we've got left. So 5, 6, and 7 all have those, so we're going to draw them out all together. The right, left. So on the right, we've got a big organ, liver. It's going to be covering 2. Along with the liver on the right, on the 6th intercostal space is the gallbladder. In the 5th, left, we've got the stomach, and stomach for the 6th as well. In the 5th, it's the acid portion of the stomach. 6 is going to be peristalsis. Now we move down to the 7th intercostal space. On the right, we've got a pancreas. Left, spleen. Now 8 through 10, it's all going to encompass the small intestine. And this point is kind of all along this 8 through 10. If you hear anything 8 through 10, think small intestine. Now we'll move down to the umbilicus, and then this triangle area around it is all going to encompass the bladder. 1 inch up, 1 inch to the right, kidney. 2 inches up, 1 inch to the right, adrenals. Now, coming off the 12th rib, little fun point that examiners love to test, appendix. And that is our anterior points. Alright, those last points are absolutely the most high yield, but we'll move on to some a little bit easier and also very important and very tested. So this is going to be the large intestine. So we go up. There's a transverse and then descending. So here we have our, ascending, right colic flexure, then left colic flexure, because here's our, patient right, patient left. Here's our ileocecal valve right here. There's a little appendix out here that's sitting along the 12th rib when we want to talk about our Chapman point. So when we think about the Chapman points for the for the large intestine, we need to think about how they kind of splay out onto an individual's leg. So, you know, here's our little dude, and he's got a little belt on. So, all this is going to flip over. The whole colon is going to flip over onto his leg. And we're going to cut it right in the middle. So here, on this right side, we're going to first have the ileocecal valve, then the ascending, then the, you know, up here, so we've got the right colic flexure, and then the right transverse, closest to, like, you know, this is where his knee is. Here's a little patella down there, and then moves on. I'm a great artist, I know. Okay, so on the other side, we're going to just keep on moving on from right there. You know, it's all splayed out, so we'll start nearest his knee because that's where we picked off right here. So we've got the left transverse, then we have the descending. Sorry, first we're going to have the left colic flexure, then the descending, then right down here we're going to have the sigmoid, and maybe rectum down here, but that's less important. So there's our colon on the, each of these is going to be along like the IT band. They're going to say the anterior aspect of the IT band, but here's our colon points. Alright, wrapping up some of the Chapman points, here we have a shoulder, there's an arm. So we have a point right in here on the inferior aspect, kind of along the surgical neck of the humerus. So that's actually going to be for the neck. We've got this weird point out here along the, you know, like deltoid, that's going to be an eye point. So that represents the retina and conjunctiva. And all these points that we're going over right now are a little bit lower yield, and I wouldn't say that I would worry too much about getting them down as much as the other ones. So here we're going to draw out a sacrum. Got a couple points along the sacrum that are a little bit important, but really they're not as important as the rest. So here we've got, you know, our little sacrum, and then there's our little eye down below. So right here we have a point that's going to be encompass actually a lot. That's going to be the abdomen, ovaries, and the urethra. So kind of a grab bag of points right along the superior aspect of that ischial bone. Down here on the inferior aspect of the ischial ring is going to be the uterus. And then lastly, the last point that we didn't discuss on our little guy, on you know, belt man, was that his prostate is actually going to be right along his right IT band as well. Again, lower yield with these points. Focus a lot on the ribs. And thank you for watching.